Hello, this is Dr. Lori Bagay from Smart Smile Dental. We get a lot of questions about dentures. Today, I'm hoping I can answer some of your questions about dentures. Dentures are appliances or, plastic or metal which carry your missing teeth on them. And, it depends on your personal situation on how a denture is designed. But dentures these days can look very pretty and very natural. You would see a dentist about getting dentures. So the first thing you would do is schedule a consultation with us to see what your particular needs are. And then we will go from there. A dentist would recommend getting dentures when you have missing teeth and you want to get them replaced. There are many options to dentures. There are bridges, there are implants. Every patient has a different need, a different situation, a different amount of bone, different, health of their mouth. And depending on each situation, including your financial situation, we would recommend something that's appropriate for you. There are removable dentures that get taken out from your mouth, or there are fixed dentures that stay in your mouth always and get removed only once in 3 months or once in 6 months to be cleaned out. So there are fixed dentures and removable dentures. Dentures are made with a variety of materials. We will find out what the most appropriate material is for you depending on your personal situation. They are usually made in conjunction with the dental office and with the help of labs. And we use very specialized labs for your particular situation. And we work very closely with very highly trained dental technicians to come up with the best result for you. In a denture appointment procedure, the first and foremost thing that we will do is collect data, maybe some x-rays, maybe some CT scan, depending on your personal situation. The dentist will examine your mouth and your gums, get the idea of how your health is, what's going on with your health, what kind of tissues you have in the mouth, what kind of bone you have in the mouth, and then they will make an appropriate recommendation for you. No, it should not be painful, depending on your personal circumstances. If we are going to take out teeth or do some surgical procedures, then of course you will be numbed or put to sleep for it, but it should never be painful. Depending on your personal circumstances, the anesthesia options are either local anesthesia or putting you to sleep. Putting you to sleep is usually when a lot of stuff is done. If it is just something small that you need, then usually it is local anesthetic or no anesthetic at all. Dentures should look and feel like as normal as possible. Sometimes there is a bit of a learning curve in wearing dentures depending on your personal circumstances, but we will guide you through all that and help you adapt to it as best as can. It's not really more difficult. There might be a couple of weeks of transition where you are learning to talk slightly differently, but it should not be anything very bizarre. Depending on your personal circumstances, it should not. Sometimes dentures are just done as an interim cosmetic procedure. While you're healing from a surgery or something, then you might have to adapt your eating style. And you can discuss that with us when you do come in depending on your personal circumstances. We will guide you through what you can eat or how to eat or, what your personal needs are. Now, depending on the kind of dentures you receive, you will get instructions on how to keep it clean. Every denture requires a different type of cleaning materials. We will guide you through all that and help you step by step in how to keep it clean, how to keep your mouth healthy, and everything that relates to it. After getting dentures, we will guide you through what you should do. Usually, there is not much special things that are needed or required unless you got a surgical procedure done. If you had a surgical procedure done, we will give you special instructions for it. If it's like a normal, removable, regular denture, usually it does not require any specific instructions. But if it does, we will always give you the instructions specific to you. Depending on your circumstances, dentures are of different kinds, meant to last a long time, or temporary dentures or dentures for life. So it depends on what kind of denture is. We will guide you through how long to expect it to last. Depending on what is going on, dentures can be repaired or replaced. Sometimes not too much of an expense, but then again, it depends exactly on what your circumstances are. For your mouth to get healed and used to dentures, usually it's only about a couple of weeks. Sometimes it's immediately used to it or there's not much of a transition. Again, it depends on your personal circumstances. Average is about 2 weeks. Insurances do pay for it if you have coverage. Obviously, you always have co-payments or your share of cost with insurances. But depending on what kind of dentures you need or what is going on, insurance may cover a portion of it. You can schedule an appointment immediately for dentures. Just give us a call at 714-744-1242. And we do have a variety of payment options depending on your personal circumstances. So do not hesitate to give us a call for an immediate appointment. I hope we've been able to answer some of your questions regarding dentures. And if you still have additional questions, do feel free to give us a call at 714-744-1242. And we will be happy to answer all your questions. We do have immediate appointments available. See you soon.